have been in IAPT right from the beginning of my career, actually. I did a BSc in Applied Clinical Psychology at the University of Exeter, and at the same time I trained to be a PWP alongside my undergraduate. So I did a placement as a PWP down in Devon, and then I went straight into a job as a PWP for Lincolnshire NHS Trust, which was great. And then I went to do a Master's at Oxford in Child Development and Education. And then after that, I went back to working as a PWP to get more clinical experience for Oxford NHS. After a couple of years, realised that I loved it and did my CBT training at Reading University. Worked as a CBT therapist for the NHS before thinking I'd like to do something different. So I went and worked for an occupational health company as a CBT therapist. So I worked delivering CBT therapy to staff members in the National Probation Service, the Prison Service, and just a few other companies as well. And then after that, I thought I would go and go the training side of things. And I became a lecturer on the PWP course at Montfort University. So I've pretty much been with IAPT and CBT principles for the whole time, really. And yeah, I love it.
So my route into IAPT was quite an indirect route, as much as PWPs are often encouraged to be from diverse backgrounds. My background was as a general nurse, and also I worked in education. And I started in mental health, working in a local community mental health service as a carer support worker. And one of my colleagues left to join an organisation called IAPT and asked if I'd be interested in going along. Did my training at University of Nottingham, and more or less as soon as I qualified, I got a band 6 job in the service, and then did some work on special projects, mainly to do with long-term health conditions, so at a local hospital and local clinics, and mainly with patients with COPD, long-term condition, medically unexplained symptoms, stroke, and diabetes. And from that, developed that passion for people with long-term health conditions and comorbid mental health problems, and helped at University of East Anglia to set up their long-term conditions training. And then I deliver the training for long-term conditions both for UEA and De Montfort.
So for me, and again relating to my area of interest, with anxiety disorders, the main principle is about helping people be more tolerant to uncertainty, and that reduces the subsequent anxiety. But in the middle of a global pandemic where we are rife with uncertainty, that has become very challenging for clinicians, because there are so many different messages in the news and the media. The guidance constantly changes. So people's tolerance to uncertainty is naturally getting worse because of the situation we find ourselves in with the pandemic. And so I think the increase in the amount of people experiencing anxiety has also added to that challenge.
So I think for me, it's all the changes that we've had in the recent year, both with the government guidelines, but also the impact personally to clinicians and to patients. So this has affected us all at the same time, but to lesser or greater degrees, is how we can help people to overcome the isolation and the loneliness that they feel, while helping them to feel safe to start to go out in the community again, to start to broaden their horizons. Because the messages have been very much quite frightening, you know, stay at home, don't do this. And now suddenly we're being told you can do this. And that can be really difficult for people, that actually you go to bed one day and you're not allowed out of your house. The next day you can go out of your house and meet people. So I think being able to manage sort of this transition in a helpful way for them, and being able to reassure them that we are doing things sort of in clinics in the best sort of COVID safe way that we can.
The two topics I'll be talking about, which is managing intolerance to uncertainty in the pandemic and hypochondriasis and the emerging COVID-19 anxiety syndrome. Those have quite a clinical focus, and I suppose I've aimed the workshops at psychological wellbeing practitioners, so the PWPs, the frontline workers in mental health, and also the content will be relevant for cognitive behavioural therapists, potentially other people working directly with patients that have got quite a clinical focus.
The main focus is from a clinical perspective, but also service leads. So I want to be highlighting some of those areas, particularly for people with long-term conditions, medically unexplained symptoms, people that are isolated and perhaps have other disabilities. So services can be developed to enable those people to access services, because for some groups of people it's been very difficult during the pandemic, when there's only been telephone contact, for them to engage in services and notice any improvements or changes.
I think after the workshop, I would like the attendees to perhaps have refreshed their understanding of intolerance to uncertainty and health anxiety, but also to feel reassured about how they can move forward with their patients, and perhaps take away a few tips that they can share with their patients, and perhaps have developed their own knowledge about how intolerance to uncertainty and health anxiety have been affected by the pandemic, so they feel better equipped to support their patients in the current context that we're working in, with a lot of uncertainty, as I've said. And yeah, I think also perhaps moving forward, feeling a bit more confident maybe to work in the current climate alongside the pandemic.
So I think I'd really like people to go away, even if it's just with one thing that they can do differently. So that one thing that can make a difference in the lives of the patients they work with, but also to have an opportunity to reflect on their own journey through the pandemic, from the perspective of how's it impacted on their sort of career, their hopes for the future, but also how they sort of see and work with patients that have had probably very similar experiences.